Gregory Johnson. And we have Joseph here with us today, who is a veteran of the United States Air Force, and we thank you for your service to our country and your sacrifice. Joseph came over to us from the Veterans Hospital, right? The VA referred you here.
Yes, sir.
Through a program called V-Basis through Tri-West, who we are already authorized with and members of. So if you are a veteran and are seeking chiropractic care on an outpatient basis, just talk to your VA doctor, your primary care doctor, and we're already in the system. So how easy was it for you to come here?
I called, I gave them the information. A couple of days later, they signed me up.
There we go. And he's already pre-authorized for 30 days worth of care. So we're going to show you how we treat our veterans. Okay, let's take a look here in the mirror for me first. Okay, Joseph, I'm going to have you close your eyes and flex your head forward and then backwards for me. Here we analyze the range of motion and also back to neutral. Yeah. Also his three-dimensional postural evaluation is taking place right now on the X, Y, and Z axes. He has a little bit of the forward head posture, which is very common, a little bit of right translation on his cervical spine. You can open your eyes for a second. See how your left shoulder is a little higher than your right shoulder because your neck is translated to the right. Now down here you have less room on the left side than you do on this right side. You see that? So your pelvis and mid-back is translated to the left. So guess what's going on here? Curvature. Okay, so let's have you lay on your back for me here first, Joseph, right here. Head this way, please, sir. Yep. Alright, so I'm doing some orthopedic neurological tests on him now. This is straight leg raise. And tell me, besides the tightness in your hamstring, do you feel any low back pain or shooting leg pain? Okay, good. Better down here though, right?
Yes.
Is your back pain or leg pain there? Okay, so he has a negative straight leg raise and knockless on the right. Or not knockless, but braggarts. Is there any pain in your hip joint or back when I do that? A little bit in the hip, okay. I say positive Fabry-Patrick on the right. Straight leg raise test on the left. Is there any low back pain or shooting leg pain besides the tightness? Pull on your hamstring. Better down here though, right?
Yes.
Any pain there? Okay. So it has a negative straight leg raise and braggarts on the left. Does that hurt your hip joint as well? Same thing? Okay, so he's got a positive Fabry-Patrick bilaterally. Push against me. Pull up. Turn in. And turn out. Good. Push. Pull. Turn in. Turn out. Excellent. So these are, I'm testing his muscles there. That tests individual nerve roots. I'm going to have you lift your head up. Is there any pain in your spine anywhere when I do this?
Left side.
Is your lower neck here and the left side in the trap? Okay, let's sit you up. Face that away. That's a positive Soto Hall test. Lower cervical, upper thoracic. Now I'm doing a maximum foramina compression test. Is there any pain in your neck at all? Okay, now I'm going to go backwards and to the right. How about this side? Right there on the left. Okay, let's go backwards and left. This one worse? Not as bad on this side? That one the same? Okay. If you just tilt your ear that way, is that causing pain? How about when I do this? That's shoulder depressor is positive on the left as well. Does that hurt at all? How about when I do this? Good. Okay, now go straight. Just turn left for me. Okay, now turn right. As far as you can go. Turn right. Yeah, this is the way you sleep all the time, isn't it?
Mm-hmm.
Yep. You can always tell how people sleep by their posture and range of motion. Now we're going to have you look straight ahead. I'm going to push down and test your deltoid. Hold. Good. Same thing over here on the left. Hold. Excellent. Okay, so I'm going to test your biceps now. Hold real hard. Good. Relax. I'm going to reposition you and test your triceps. I'm going to push in. Hold. Excellent. Same thing here. Biceps. Good. And tricep. Excellent. Now we're going to test his reflexes. Upper and lower. His biceps first. That's good. +2. Triceps. Good. Okay. Biceps good. Brachioradialis good. Triceps good. Patellar reflex fine on the left and right. Okay, just relax your foot. Achilles is fine on the right and the left. Good. Okay, now, if you can just stand up for me, Joseph, and walk that way on your tiptoes only for about 3 steps. Perfect. Now your heels only for about 3 steps. Good. You can turn around, face back towards me now. I'm going to have you bend over like you're going to touch the floor and tell me if and when you have any back pain or neck pain.
Okay.
And pretty good flexibility, really. Good. No back pain or neck pain?
Just pulling
Down here?
in my hams.
Oh, and your hamstrings. Okay. As you come back up, is there any low back pain? Or upper back, either one? Okay, lock your knees straight. Cross your hands up here. If you go straight back, does this cause your back to hurt at all? It does? Okay, so now I'm going to twist you left and push down. Does that increase that pain?
Yes.
I say positive Kemp's test on the left. How about this right side? Does that increase the pain?
No.
Okay, so he has a negative Kemp's on the right, positive on the left. Just relax. Stretch to the left like this for me. Tell me if that hurts anywhere along the course of your spine. Okay, now to the right. Anything there?
A little more.
A little more pulling on that side there. Okay, now straight and just twist left. Is any pain doing that? And how about when you twist right? Anything there? Great. Okay, good. Let's come over here on your stomach next. So he's pretty good on his orthopedic neurological evaluation so far. Now I'm going to be examining his spine. His legs are even, that's a good start. And the right one gets longer. I bet you that tightens up right there in your lower back. Yep. So he does have a positive Knockless test. His pelvis and low back raised up when I brought his legs up and the right leg got longer. You sit on this wall on the right side all the time. I bet that's tender right there. Yep, that's the sacroiliac joint. Now there's L5. That's the one that you have the spondylolisthesis on. Is that a little more tender on the right? Real tender right in the center though, huh? Where I'm touching them. See, that spasm goes all the way up into the thoracolumbar region. You feel that on both sides?
Yes, that's tight.
Yep. Really bad right there. This is called palpation. This is where the chiropractor touches the spine and feels exactly where the vertebrae are misaligned. That's out right there. That's a rib. You ever feel pain around your ribs?
Yes.
Yep. Yeah, let's see.
Right
there's out, and right there too. Ooh, that one's bad right there on the left. And is this where your headaches usually come from, right there?
Yes.
Yep. Right there on C2 on the right. You get sinus problems as well?
I've been having them the past week.
Yep. Boy, T5, 6, and 7 are all interior.
That right there.
Uh-huh. You get big time spasm here. You ready to feel better?
Mm-hmm.
Okay, so I've examined him. He's already had an MRI done recently, which shows some degenerative disc disease in the lumbar spine, lower lumbar spine. So I'm going to give him the full meal deal here at Advanced Chiropractic Relief today. And if you want to read more about our veterans program, you can go to our website, which is www.advancedhoustonchiropractor.com. And in fact, our very first page is on veterans. There's L5, L4, L3. These are all sore, aren't they? L2, L1. Okay, now I want you just to breathe normally and exhale for me. Okay. Just let it all relax. That's what I'm looking for. Okay. That's it. Oh boy, got some excellent movement up there. That was better. Okay. So now we're going to recheck that. Legs remain even down here, but see, the big thing is they stay even the whole way and his pelvis doesn't raise up. That didn't tighten up as much either, did it? Okay, so I'm going to pull out some heavy equipment on you here, Joseph. It's going to sound like I'm sawing you in half, but I'm not. This is 8 miles faster than you. As I was doing the mile faster release here with the Turbonator, which is really just a modified Black & Decker jigsaw, right in the thoracolumbar region. Did you feel it mostly right through here, Joseph? Yeah. And you can also see his muscles spasming a little bit when I was doing it over that area. But this will help break up those fibers and get blood flowing into them, break up the fascial myofasciitis, they call it. Helps break up trigger points, which are just metabolic waste dumps in the muscles. Joseph also does massage therapy, and he's going to bring us his cards next time, so we'll be referring some patients over to him for massage therapy. Our other massage therapist got sick and has been out of commission for a while, so we're going to start using Joseph because he's strong with deep tissue. Deep tissue massage and chiropractic go hand in hand and complement each other. I always recommend getting the massage after the adjustment, however, because sometimes if you get it before the adjustments, the muscle tonus is a little bit tighter and you don't get as good of an adjustment. Get his hamstrings all the way down into his calves. Okay. So, let's go ahead and turn you on your back now, Joseph. Now I'm going to adjust his cervical spine. And you can just put your hands right there on these kind of perfect. Perfect. Good job. Yes, sir. You guys are going to get a treat today because you'll get to see a first time spinal decompression. There we go. Good. And these military guys, they're a lot tougher than the average bear. There we go. You should have felt that in your knee and your back, did you?
Yeah.
Okay, let's sit you up and face towards your knee there for me, Joseph. Have you seen other chiropractors in the past?
No, it has been a year and a half.
Year and a half? Okay. There we go. There, okay. Now let's check your elbows here. This is the elbow you got problems with, right?
Yes, sir.
Just let it go in my hand. Good. Just your base and all them down here. Your digits. Excellent. This is the way we adjust carpal tunnel syndrome too, for those of you out there who have carpal tunnel. Would you mind sharing with our YouTube viewers how you found us and what brought you in here?
I searched for the best chiropractic care with my zip code. This was one that popped up. I clicked on it. He was working on another veteran, and I liked the way his practice was. And it's pretty good. I seen some scriptures too, so it made me fall in love.
There you go. Thank you very much. And if you go to our website, we actually have a connection or hyperlink, if you will, to our YouTube channel so you can watch it. We got like 240 YouTube videos on there now of actual treatment on people. So let's come over here and finish yours up. Alright, let's have you lay on your back on this table. Anyone that has any disc problems such as degenerative disc disease, herniated disc, bulge disc, this is the absolute best adjustment in the world for that. It's a manual spinal decompression. Unlike the computerized decompression machines, I'm doing this one by feel, and we actually get a greater negative vacuum within the disc doing this adjustment. These reflexes are fine, so I'm going to put this towel right under your skull and then wrap this around your chin. Take a deep breath in. Keep your teeth together, let all your air out now, and just let me kind of decompress you. There we go, good. How far down did you feel that? All the way down? Okay. So, now we get to shoot you, and then we're done. So how was that for the first time decompression? Did you feel it all the way through?
Oh yeah.
Did it?
I feel good.
Yeah.
I'm ready immediately.
Yep. This is an immediate adjustment relief. Okay, let's stand you up over here. Yeah. There you go. So this is a Atlas specific adjusting instrument. Now I'm going to have you close your eyes and flex your head forward and backwards again, Joseph. And then neutral. Yep. Okay, so take a look in the mirror now. Here's your homework right here. You're going to lift up with your traps, pull back with your rhomboids, hold those up for me and back. Flare your hands with your palms forward. See, that tightens up your entire trapezius. Then we're going to bring your head straight back in the Z-axis, a little bit left on the X-axis, and then straight up to the ceiling. Now I want you to shift your pelvis straight to the right. There you go. You're going to feel a little tap right here. When I adjust the Atlas with the patient in a mirror imaged posture, we are affecting the cerebellum. You can relax. Now when you go forward and backwards this time, it should feel a little bit smoother. Try and see.
Oh yeah. How does it feel back?
Better, huh? Yep. Take a look at the mirror now. See how you're straight across? Your hands aren't so far out front of you before they're way out here, so they're coming back a little bit eventually. We'll get them here and see how much more even you are now here. So see, that'll square your shoulders off. So this is your exercise. You're going to pull up, back, head straight back, left, up to the ceiling, and then shift your pelvis way right. And then you can tap that right under that big bone right there, and that'll actually help retrain your cerebellum.
Okay.
Because your cerebellum controls balance, posture, coordination, and all movement in the body.
Okay.
All right, so how'd that feel for you? Did you get some immediate relief?
Yeah, I feel pretty good now.
Great.
I can go back to the gym.
Very good. All right, thank you so much, Joseph. Thank you for your service again. All right, this is your Houston chiropractor, Dr. Gregory Johnson. We'll see you next time.